Tonight we continue our COVID-19 Q&A, where we talk with local officials and experts. Our own Wendy Davis sat down for a Skype interview with Pennsylvania's Lieutenant Governor John Fetterman last night to talk about the governor's decision to shut down the state and about whether there's any end in sight.
Today, the governor announced that he is going to do a shutdown, stay-at-home order for the entire state of Pennsylvania. Why today? What was it that occurred that made that happen?
I just think it was the right decision, first of all. Flattening the curve, the governor was way ahead of that in terms of shutting Pennsylvania down and taking the steps necessary to make sure that we can contain the virus. So I think it just made sense to do it at that point, and it was the right call, and I'm glad he did it.
Is there an end date? I know a lot of people are asking. The president said April 30th. We're hearing some governors, like Virginia, saying June.
Sure.
Any idea what it would be for us?
Well, what I can absolutely say is that nobody knows. You mentioned a bunch of different states. Well, none of them actually know. We're on the virus's timeline. And as long as Pennsylvania continues to do the job that it's doing and flattening this curve, there's reason to be optimistic, but we certainly can't let up. I try to emphasize to people that the Pennsylvania resident that's willing to stay at home and stay apart when they are out is more lethal to this virus than a Clorox wipe. And it's just a fact. That's the one thing that we can all do that will absolutely kill this virus and get us back to normal faster.
We hear a lot of business owners, small business owners especially, being concerned that big box stores are allowed to stay open and sell paint, sell plants, seeds, etc., while some smaller companies, paint stores and nurseries are being forced to shut down. Is there anything being done to kind of ease up on smaller businesses being able to stay open?
Sure. Yeah, well, the thing is like as you probably have noticed, the list is back and forth in terms of it's changed. Like laundromats, for example. The governor announced today that liquor stores are going to be performing online sales now. The governor is always trying to strike a balance between lives and livelihood, and doing what he believes is best for Pennsylvania, and doing what's best for Pennsylvania is again, that delicate balancing act. But the main thrust of all of these corrective actions is to stop this virus cold, to not allow it to overwhelm our healthcare system, and to save as many lives as possible.
We're going to resume our conversation with Pennsylvania Lieutenant Governor John Fetterman. WFMZ's Wendy Davis spoke with him about the pandemic and asked him something a lot of you have asked us. Can the state do anything to keep people in hard-hit New York from coming to areas like Reading and the Poconos?
With respect to the border, no, it can't be closed. It's not, one state can't close its border to another state. But the governor did, they are eliminating those short-term Airbnb rentals, so that it's been reported that people from New York are kind of fleeing New York and looking for these short-term rentals in areas that you mentioned. And stopping that is also been activated. So it's definitely an issue the governor's discussing. The bus routes that come in between northeastern Pennsylvania and New York City, all of that's being looked at, and it's absolutely something that is going to be addressed, that is within the permitted statutes.
And then hospitals, obviously, a big part of this, staffing there, supplies there, people concerned about that. I know other governors have complained, feel like there's a bidding war going on with not only with each other, but with the federal government. What are you hearing about that? How prepared is Pennsylvania?
Well, Pennsylvania is prepared, and we have a significant capacity remaining. Last time I checked, our ventilator capacity was at 75%. In other words, we still had room to grow. And that really emphasizes to me, and I would emphasize to your viewers, that we need to keep flattening this curve. My hope, my dream, to kind of put it simply, is that we keep as many ventilators in the box as possible. I'd love to leave as many of them in their boxes as possible. But that's going to be dependent on what everyone in Pennsylvania is willing to do. And the hope is that we will have capacity and our hospital systems will not be overrun. And somebody might feel like, well, I'm young, it doesn't matter if I get it. It's like, well, you can spread it, and probably would if you ignore these guidelines. And the elderly are particularly vulnerable, and it's particularly lethal to that age group. And if you don't, aren't worried about yourself, think about your grandparents, think about somebody else's grandparents, think about somebody else whose immune system is suppressed. I mean, there's any number of reasons to just stay home and stay apart and only conduct essential business when you do leave your home.